Welcome to Mental Health Minutes. I'm Dr. Donna Kimmel, a psychologist, counselor, and physical therapist in the Washington metropolitan area. Today I have a very special guest with me, Dr. Anita Gadhia-Smith, who is a psychotherapist in the Washington, D.C. area, and who, by the way, is a real expert in counseling substance abuse and all kinds of addictions because she was there herself. Welcome very much to my show today.
Thank you very much.
I also want to mention that not only are you a psychotherapist who specializes obviously in substance abuse and addictions and in working on relationships, but you have recently written a book called From Addiction to Recovery, A Therapist's Personal Journey. And the book, I know, is available at Amazon.com.
Mm-hmm.
So, you have a lot to share with my audience today, and I'm looking forward to what you have to say. First, would you tell us all a little bit about your addiction and how you ended up in recovery?
My own personal history was that my addiction started when I was about 12 years old. It spanned 15 years. I got sober when I was 27 years old, and I went through a long process of going through different substances, and then in the last 3 years hitting a bottom, and then finally reaching out for help.
What do you think brought you to addiction when you were so young? How did you happen to become addicted? Do you know?
My feeling is that it was a combination of genetic predisposition and environmental factors, coupled with issues from my childhood and emotional pain, loneliness, and an inability to cope with what was going on in my life and to soothe myself in a constructive way.
Did you at the time realize that you were addicted? Had you thought of getting help of any kind? What was that life about?
I didn't really think that being addicted was a problem for a very long time. I grew up in the 60s and the 70s, and that was the era of sex, drugs, and rock and roll. And there was it was very appealing to live the wild life in many ways. And while I was addicted, I didn't see that was really something that I had to overcome until much later. I really felt that it was something that could be controlled and managed, and that I could go on and live life anyway and be addicted.
So what was it then in the last 3 years that made you change your mind about that?
Well, my mind changed before the last 3 years, because what happened was that my life did not evolve and progress as it should have. With other people my age were going to college and then going on to graduate school, getting married, starting families. They were doing things, and I was kind of stuck in a very non-productive place in my life, and I knew that I was in a self-imposed prison, and I knew that I had to get out. And the last 3 years, I tried to get out by myself and really couldn't do it because it wasn't something that I could do alone.
You mean you tried to stop using or drinking? At the time, during the last 3 years, were you what substances were you abusing? Alcohol and something else?
Alcohol, cocaine, pills, marijuana, hallucinogenics, and heroin, all at different times.
Wow. So you were really messing with your brain.
Mm-hmm.
And when you finally decided that was enough, what did you do? And by the way, this story is in your book.
Mm-hmm.
Okay, so then just briefly, what did you do? Because people can read your story in your book.
Yes.
But just tell us how you got from messing with your brain in that way to being clean. Do you refer to it as being clean or sober, or clean and sober?
I personally refer to it as sobriety, but
sobriety.
that includes being clean
Okay.
from drugs and alcohol.
Okay. So what finally brought you there?
Well, first I had to hit a bottom, and I was what somebody would consider a high-functioning alcoholic or addict, because I went to Johns Hopkins University, a very fine university. Before that, I was in private school. I had very good grades. I kept things looking fine on the outside, and the lie that I told myself was that if it looked okay, then I was okay.
Mm-hmm.
But emotionally, I was dying inside.
Yes.
And the vastness of the emptiness kept growing and growing until there was absolutely nowhere to turn, and no amount of drugs or alcohol would take the pain away. So I did reach out for help, and first I tried on my own to wean myself off. At the very end, I was addicted to opiates, to pills, and I tried to wean myself off by systematically cutting down, but I could not stay off of it. I would get very far down, but I couldn't cross the mountain into the valley of, the promised land, because I kept turning back. And this went on for the 3 years. And then finally I did reach out for help from other people beyond myself.
Did you go to see a psychiatrist? Did you go to a group? What was that transition?
I started going to recovery groups.
Okay.
And I immediately saw people my own age who were laughing and enjoying their lives and having a good time, and it was very, very attractive. I had never known people my age that knew how to have a good time without drinking and taking drugs. And I could see that these people really had something I wanted, because they had confidence, they knew who they were, they had a sense of self, and they knew how to live, and I didn't have any of that.
Which leads me to another question that I think is very important, because I have been told by a number of people that one of the reasons they won't stop drinking and drugging is because they're afraid of what that transition would be. They're afraid of withdrawal. Did you experience withdrawal? And tell us about the switch from being an abuser to then being in recovery, that transition, the first, let's say, weeks, months, maybe even years.
Well, I just went to recovery groups, and in retrospect, I really wish I had gone to treatment, because if I had, I would have had medical help, and that would have made the transition a lot easier. I basically detoxed myself and went through incredible physical and emotional anguish through that transition, and it lasted for about 18 months.
Wow.
And this is part of why the recidivism is so high, because it is so difficult to go through early sobriety.